the people who did better were the people who had either tumours at the esophagogastric junction, people who had performance status 0, in other words, no real cancer-related symptoms, and patients who had a relatively longer time from their previous chemotherapy. So I think you could say that that group is the group of people who are likely to do better. But if you look at the performance status 2 patients, who are the least fit group, and that was about 17% of the patients on the study, and they're people that, to be honest, a lot of oncologists, myself included, in our day-to-day practice would be very cautious about offering these people any form of chemotherapy. And what we saw with those patients is that the drop-off rate was quite quick to start with. But for those patients who did okay, actually in the long term their benefits were as good, not as the performance status 0 patients, but as the performance status 1 patients who we would normally treat without question. So I think it's probably right to say that that is a group of people who may well not tolerate treatment, but the other argument to that is that if they do tolerate it, they probably get the same benefit. And maybe that's a group of patients that you might consider starting off at a lower dose, or certainly having a more detailed discussion about the potential risks and benefits of this sort of treatment.